is Angela. I'm going to be your nurse today.
Ensure privacy and place your supplies near the client's bedside. Introduce yourself and explain the procedure to the client. Perform hand hygiene. Use 2 acceptable identifiers to confirm that you have the right client. Check for an allergy band. If the client is able, verbally confirm the allergy. If the client does not have an allergy band, confirm that the client has no known allergies. After performing 2 of the 3 medication administration checks prior to entering the client's room, perform the 3rd check by comparing the formula with the provider's order to make sure you have the right client, the right feeding, the right dose, the right route, and the right frequency. If the provider prescribed intermittent feedings, assess your client's learning needs. Make sure she understands the intent of the feeding and any possible adverse reactions. Don gloves. Assess for any signs of redness, swelling, irritation, bleeding, drainage, or skin breakdown. If you find any of these conditions, consult with the provider. Assess gastrointestinal tract function by auscultating for bowel sounds. Absent bowel sounds may indicate decreased motility. You should report this to the provider. Check the expiration date, the integrity, and the cleanliness of the formula container. The formula should be at room temperature to avoid gastric cramping. Connect the pre-filled formula container using aseptic technique. Set up the pump according to facility protocol. This client has a feeding bag of sterile water hanging along with the formula to provide free water, per her provider's orders. Verify tube placement by using at least 2 methods after initial verification by an abdominal X-ray. Confirm the length of the tube at the point of entrance with the order and documentation to make sure the tube has not dislodged. Inject 30 milliliters of air into the tube to clear it of formula, medication, or flush solution. Gently pull back on the plunger to aspirate 5 to 10 milliliters of fluid. Assess the appearance of the aspirate and its pH to help confirm placement. Clear the syringe and inject 30 milliliters of air. Test the pH of the fluid you placed in the cup.
Now I'm just going to check the tube residual.
Next, measure the residual volume by aspirating until you feel resistance from the plunger. Once you obtain the residual volume, return the residual fluid and flush the tube with 30 milliliters of water. Follow your facility's policies and procedures for returning aspirated contents to the stomach. Contact the provider about excessive residual, typically more than 250 milliliters, or when the tube placement is in question.
Just going to flush the tube, and then we'll go ahead and start your tube feeding.
To begin the feeding, connect the distal end of the tubing to the proximal end of the feeding tube. Connect the tubing through the infusion pump and set the rate. Make sure the roller clamp is open and all connections are secure. Then start the infusion. When you complete the feeding, document the client's response, especially any adverse effects related to the feeding or the infusion. Anytime the tubing is disconnected, flush the tubing with 30 milliliters of water so that the tube does not become clogged. You can do this manually or program the pump to flush the tubing when feeding is complete.